What we learn from the most important mistake in history. Imagine holding a document in your hands that could save millions of lives, prevent decades of suffering, and alter the course of human civilization. Now imagine throwing it in the bin, calling it too radical, and walking away. This isn't fiction. It happened in 1847, and the man who made this catastrophic mistake didn't just ignore a breakthrough. He actively destroyed the career of the doctor who tried to save countless mothers and babies from agonizing deaths. The ripples of this single act of arrogance killed more people than some wars. Yet hardly anyone knows the name Ignaz Semmelweis today. But they should, because what happened to him and what we learn from it changed medicine, science, and how we think about truth itself forever. The Death Ward. In the spring of 1847, the General Hospital in Vienna had a dark secret that everyone knew, but nobody could explain. The hospital had two maternity clinics, side by side, identical in almost every way. Yet women would literally beg, scream, and plead not to be admitted to the first clinic. Some would rather give birth in the street, becoming street births that carried social stigma, than enter through those particular doors. The reason was simple and terrifying. The first clinic was a death sentence. While the second clinic had a maternal mortality rate of about 4%, the first clinic's rate hovered between 10% and sometimes peaked at a staggering 35%. That meant that on some months, more than 1 in 3 women who entered to give birth would die within days, consumed by childbed fever, a mysterious condition that caused fever, abdominal pain, and agonizing death. The victims weren't just statistics. They were young women, often first-time mothers who had survived the ordeal of childbirth only to be struck down by an invisible killer. Their symptoms appeared within 24 to 72 hours after delivery: soaring fever, rapid pulse, severe abdominal pain, and then, inevitably, death. Doctors called it puerperal fever. The women called it the doctor's plague, and nobody knew why it happened. Enter Ignaz Semmelweis, a 29-year-old Hungarian doctor who had just been appointed assistant to the professor of obstetrics. Obsessive and detail-oriented to the point of being considered difficult by his colleagues, Semmelweis couldn't accept the standard explanations for the mortality difference between the two clinics. The prevailing theories were numerous and confidently stated. Some doctors blamed miasmas, bad air that somehow carried disease. Others pointed to overcrowding, though both clinics were equally crowded. Some suggested it was divine punishment, or that the women were simply more delicate. One popular theory held that the shame and fear women felt when examined by male doctors, the first clinic was staffed by doctors and medical students, caused an emotional disturbance that somehow led to the fever. The second clinic, staffed by midwives, had far fewer deaths, which seemed to support this theory. Semmelweis systematically dismantled each explanation. He studied the architecture, identical; the ventilation, identical; the overcrowding levels, identical. He even had the priest change his route through the hospital, as some believed the sight of the priest giving last rites frightened women into illness. Nothing changed. Then, in March 1847, something happened that would crack the case wide open, though it came at a terrible price. The Clue, Written in Blood. Professor Jakob Kolečka was Semmelweis's friend and colleague, a forensic pathologist who performed autopsies in the morning and taught medical students in the afternoon. During one routine autopsy, a student's scalpel accidentally nicked Kolečka's finger, a minor cut, the kind that happened regularly in the autopsy room and was generally ignored. Within days, Kolečka fell ill. The symptoms were horrifyingly familiar to Semmelweis: fever, swelling, abdominal pain, delirium. Less than a week after the cut, Kolechka was dead. When Semmelweis attended his friend's autopsy, something clicked in his mind with the force of revelation. Kolechka's internal pathology was nearly identical to the women dying of childbed fever. The same inflammation, the same infected tissues, the same systemic destruction. A forensic pathologist had died displaying the same internal condition as new mothers. The connection seemed impossible, yet there it was. Kolechka had been infected by something on the autopsy scalpel, something that came from a cadaver. And where did the doctors and medical students in the first clinic spend their mornings before attending births? In the autopsy room. The realization hit Semmelweis like a physical blow. Doctors, himself included, were going directly from dissecting corpses to delivering babies, washing their hands only superficially with soap and water. The smell of death literally clung to them. Some doctors even took pride in the smell, seeing it as a badge of their hard work and dedication to medical science. Medical students would finish dissecting a woman who had died of puerperal fever, wipe their hands on their aprons, and minutes later perform vaginal examinations on laboring women. They were carrying death on their hands from the morgue to the maternity ward. The second clinic, staffed by midwives who didn't perform autopsies, had far lower mortality rates because they weren't contaminated by cadaveric material. It wasn't miasmas, nor divine punishment, nor female delicacy. It was the doctors themselves. Semmelweis had discovered one of the most important truths in medical history. Diseases could be transmitted by healthcare workers from patient to patient. He'd discovered germ theory before germs had even been seen. But instead of being celebrated, he was about to become medicine's most tragic figure. The solution that nobody wanted. In May 1847, Semmelweis implemented a simple rule. All doctors and students must wash their hands in a chlorinated lime solution before examining any patient. The substance was strong enough to remove the death smell. Strong enough, he believed, to remove whatever invisible particles carried the deadly fever. The results were immediate and dramatic. In the months before hand-washing was instituted, mortality rates in the first clinic reached 18%. In the months after, they plummeted to around 1 to 2%, lower than the midwives' clinic. In 1 month, not a single woman died. Semmelweis had just proven, through empirical evidence, that thousands of deaths could be prevented by a simple hygienic measure. He had discovered a way to save mothers, preserve families, and prevent incalculable grief. This should have been his moment of triumph, his entry into medical history as a hero. Instead, the medical establishment turned on him with the fury of wounded pride. The doctors hated Semmelweis's theory for several reasons, each more damning than the last. First, it implied that gentlemen could transmit disease, that their very bodies could be vectors of death. In the rigidly hierarchical society of 19th century Vienna, this was considered an impossibility. Gentlemen, by definition, were clean. Disease was something that afflicted the lower classes. Second, and more devastating, it meant that doctors had been killing their patients for years. Thousands of them. The implication was unbearable. The very people who had dedicated their lives to healing had been the agents of death. Every doctor who had lost a patient to childbed fever now had to consider that he had killed her through his own contaminated hands. Third, Semmelweis couldn't explain why hand-washing worked. He spoke vaguely of cadaverous particles, but he couldn't show them or prove their existence.
The microscopic world of bacteria was still unknown. Germ theory wouldn't be developed for another 2 decades. To his colleagues, Semmelweis was asking them to change their entire practice based on an invisible, unproven mechanism. And finally, Semmelweis was a terrible diplomat. He was abrasive, obsessive, and increasingly angry as his theory was rejected. He began writing open letters to prominent obstetricians across Europe, calling them ignorant murderers. He accused them of being irresponsible killers and said that their refusal to accept his findings made them culpable for every death. He wasn't wrong, but he wasn't winning allies either. The destruction of a genius. The backlash was swift and brutal. Johann Klein, Semmelweis's superior and head of the first clinic, felt personally attacked by the implication that his practices had killed patients. Rather than investigate Semmelweis's findings, Klein refused to renew his contract. In 1849, Semmelweis was forced out of Vienna. He moved to Budapest, where he eventually secured a position at a smaller hospital. Again, he implemented hand-washing. Again, maternal mortality rates plummeted. And again, his findings were largely ignored or dismissed by the wider medical community. Across Europe, prominent doctors published papers refuting Semmelweis. They argued that his statistical methods were flawed. They suggested that the decrease in mortality was due to other factors: changes in weather, different patient populations, improvements in ventilation. Anything but the uncomfortable truth that their own hands were killing their patients. The most painful rejection came from Britain, where The Lancet, the prestigious medical journal, published editorials dismissing Semmelweis's work. British doctors, who prided themselves on empiricism and scientific rigor, found his theory crude and unscientific. Some suggested he was mentally unstable. They weren't entirely wrong about the mental instability, though they had cause and effect backward. The constant rejection, the knowledge that women were still dying from a preventable cause, and the frustration of being unable to convince his colleagues drove Semmelweis toward psychological breakdown. His behavior became increasingly erratic. He grew paranoid, seeing conspiracies everywhere. His public denunciations of other doctors became more vitriolic and less effective. Friends became concerned. His family was alarmed. In 1865, Semmelweis's family and colleagues conspired to commit him to a mental asylum. The story of what happened next is disputed, but the most commonly accepted account is harrowing. Semmelweis was deceived into visiting what he thought was a different institution, then forcibly restrained when he tried to leave. In the asylum, Semmelweis was beaten by guards during his attempts to escape. He developed an infection, possibly from the beating, possibly from the unsanitary conditions of the asylum itself. The infection spread rapidly. The symptoms were grimly ironic: fever, inflammation, systemic infection, the same type of sepsis that had killed Jakub Kolečka and so many new mothers. On August 13, 1865, just 2 weeks after his admission to the asylum, Ignaz Semmelweis died. He was 47 years old. The man who had discovered how to prevent infection died of an infection. The doctor who could have saved millions died despised, rejected, and considered mad. His obituaries were brief and dismissive. Medicine moved on.
On without him. The vindication that came too late. Within a decade of Semmelweis's death, everything changed. Louis Pasteur in France and Robert Koch in Germany developed germ theory, proving that invisible microorganisms cause disease. Joseph Lister in Britain developed antiseptic surgery based on similar principles to Semmelweis's hand-washing protocol. Suddenly, Semmelweis's cadaverous particles had a name: bacteria. The medical establishment that had rejected Semmelweis rushed to embrace Lister, who had the advantage of better timing, better communication skills, better political connections, and the backing of germ theory. Lister was knighted. He became famous. He deserved his recognition, but he wasn't the first. As germ theory gained acceptance, doctors began to look back at Semmelweis's work with dawning horror. They realized he had been right all along. His statistics were solid, his reasoning was sound, and thousands of women had died unnecessarily because the medical establishment had rejected him. The rehabilitation of Semmelweis's reputation began slowly. Medical historians started calling him the savior of mothers. Hospitals were named after him. In 1924, nearly 60 years after his death, the house where he was born in Budapest was turned into a museum. In 1969, a university in Budapest was renamed Semmelweis University in his honor. But recognition after death is cold comfort. The tragedy isn't just that Semmelweis was right and was rejected. It's that the pattern he represented of truth-tellers being ignored by established systems has repeated throughout history and continues today. What we learned and keep forgetting. The Semmelweis story isn't just medical history. It's a cautionary tale about how humans respond to uncomfortable truths, and it gave the world a new term, the Semmelweis reflex, the tendency to reject new evidence because it contradicts established norms and beliefs. The most important lesson is about cognitive dissonance and professional pride. The doctors who rejected Semmelweis weren't stupid or evil. They were intelligent, educated men who had dedicated their lives to healing, but they couldn't accept evidence that fundamentally challenged their self-image and implied they had been harming patients. This psychological pattern appears everywhere. Scientists reject data that contradicts their life's work. Organizations ignore warning signs of disaster because acknowledging them would require admitting past mistakes. Experts dismiss insights from outsiders because accepting them would diminish their own expertise. The second lesson is about the power of invisible threats. Before germ theory, the idea that invisible particles could kill seemed like mysticism. Today, we understand bacteria and viruses, but we still struggle with other invisible threats: climate change, systemic bias, emerging risks in artificial intelligence. We're better at dealing with visible, immediate dangers than with gradual, invisible ones that require believing in things we can't directly perceive. The third lesson is about evidence versus explanation. Semmelweis's critics weren't entirely unreasonable in wanting to know why hand-washing worked. In science, understanding mechanism is important, but the refusal to implement a proven, life-saving intervention simply because the mechanism wasn't understood was catastrophic. This tension between empirical results and theoretical understanding still causes problems in medicine and public health. We saw echoes of this during COVID-19, when early evidence for mask effectiveness existed before the mechanism of aerosol transmission was fully accepted. Some authorities hesitated to recommend masks, partly because they couldn't explain exactly how they worked. The Semmelweis pattern repeated. Evidence was available, but without complete theoretical understanding, implementation was delayed. The fourth lesson is about communication and personality. Semmelweis's abrasive style and increasingly harsh denunciations, while emotionally understandable, were strategically disastrous. Being right isn't enough, especially when asking people to make uncomfortable changes. The messenger matters. Lister succeeded, partly because he was better at diplomacy, presenting his ideas in ways that didn't directly attack his colleagues' competence or character. This doesn't mean truth-tellers should compromise their message, but it suggests that how we present difficult truths affects whether they're accepted. Social movements, scientific reformers, and whistleblowers all grapple with this tension: how to be urgent without being dismissed as hysterical, how to be critical without triggering defensive rejection. The pattern continues. The Semmelweis pattern didn't end in 1865. Medical history alone is full of similar stories. Barry Marshall and Robin Warren discovered that stomach ulcers were caused by bacteria, not stress or spicy food, in 1982. The medical establishment rejected their findings for over a decade. Marshall eventually drank a culture of the bacteria to prove his point by giving himself an ulcer. They won the Nobel Prize in 2005, 23 years after their discovery. Cigarette companies and some doctors rejected evidence of smoking's harmful effects for decades, despite mounting statistical proof, causing millions of preventable deaths. Lead poisoning from gasoline and paint was identified as a public health crisis decades before regulations were implemented, with industry-funded experts dismissing the evidence while children suffered brain damage. Outside medicine, the pattern appears everywhere. Climate scientists have been documenting global warming for decades while facing denial and attack. Economists who warned of the 2008 financial crisis were ignored until disaster struck. Engineers who warned about the Challenger space shuttle's O-rings were overruled by administrators, resulting in catastrophe. The Semmelweis story teaches us to ask, what are we rejecting today because it's uncomfortable? What evidence are we dismissing because accepting it would require admitting we've been wrong? Which modern Semmelweises are being ignored while preventable harm continues? The gift of the mistake. Here's the surprising truth. The mistake made in rejecting Semmelweis, while catastrophic in its immediate effects, ultimately taught us something invaluable. It became a perfect case study on how not to handle scientific evidence, how cognitive biases affect even experts, and how institutional resistance to change can be literally deadly. Medical schools now teach the Semmelweis story as a cautionary tale. It's used in courses on medical ethics, evidence-based practice, and the sociology of science. His tragic arc from breakthrough to breakdown serves as a warning against professional arrogance and the dangers of rejecting empirical evidence. More broadly, the Semmelweis reflex has become a recognized psychological phenomenon. By naming it, we've made it visible, and things we can see, we can potentially overcome. When organizations discuss resistance to change or innovation, someone can now say, "Are we having a Semmelweis moment?" That question alone can shift thinking. The mistake also crystallized an important principle that guides modern evidence-based medicine. Empirical results matter even when we don't fully understand mechanisms. If something works reliably, we should use it while continuing to investigate why it works. Waiting for perfect understanding before implementing proven interventions isn't scientific caution. It's paralysis that costs lives. Perhaps most importantly, Semmelweis' story reminds us that truth has a peculiar property. It persists. It may be rejected, mocked, and suppressed. Its discoverers may be destroyed, but eventually reality reasserts itself. The bacteria didn't care about professional pride or institutional resistance. They kept killing until their existence was finally acknowledged and addressed.
The question we must keep asking. The most important mistake in history wasn't just the rejection of Semmelweis. It was the failure to ask a simple question. What if he's right? That question, that willingness to consider uncomfortable possibilities, is the antidote to the Semmelweis reflex. It doesn't mean accepting every new claim uncritically. It means engaging seriously with evidence that challenges our assumptions, especially when that evidence could prevent harm. In our own time, we face challenges that require this kind of intellectual humility. Some of tomorrow's accepted truths will come from today's dismissed warnings. Some current consensus views will be revealed as catastrophically wrong. The Semmelweis story teaches us to hold our certainties lightly, to value evidence over ego, and to remember that being a respected expert doesn't make us immune to blind spots. It might make us more vulnerable to them. Ignaz Semmelweis died rejected and alone, but his discovery lives on in every hospital where healthcare workers wash their hands before touching patients. That simple act, performed billions of times a day worldwide, prevents countless infections and saves innumerable lives. The tragedy is that it could have started saving lives 20 years earlier if pride hadn't trumped evidence. The hope is that by remembering his story, we might catch ourselves before making similar mistakes. We might ask, what if they're right, before dismissing uncomfortable truths? We might choose humility over certainty when the stakes are measured in human lives. That would be the ultimate vindication of Ignaz Semmelweis, not monuments or honors, but a world that learned from the mistake of rejecting him, a world that doesn't need martyrs for truth, because it's willing to hear truth from anyone who speaks it. His mistake wasn't his own, it was ours. And the lesson it teaches is one we must keep learning over and over until we finally get it right.